All right, we are live. I am so excited to have a fantastic guest with me today. So, if we haven't met, I'm Dr. Obidi at Partners in Pediatrics and Family Health. I'm a pediatrician here. We are family practice. We see both adults and kids. And it's just my pleasure to be able to come every week with a wonderful guest. This week is no different. This week, we are going to be talking to Dr. Toyosi, who is an associate professor of medicine hematology at Duke University School of Medicine, and she obtained her medical degree at Duke University and her master's in clinical investigation from Northwestern University, and she completed her internal medicine residency at Duke University. She's fellowship trained at McGraw Medical Center of Northwestern University, and she's a hematologist, a clinical researcher, and she loves to help other clinical researchers develop help other academic clinicians build research programs, whether they have a mentor or not. We'll talk about that later on. But I am so excited to have her on here. If you happen to be joining us live, go ahead and say hello. I would love to shout you out. If you're watching this as a replay, type hashtag replay. We'll stop by later on and say hello. So welcome, Dr. Toyosi. It's such a pleasure to have you on here live.
Dr. Mecca, thank you for having me. It's such a pleasure to be here.
Oh, the pleasure is mine, mine, mine. Well, tell you what, why don't we start off by just, if you could introduce yourself, I introduced you, but if you could tell us why you chose that field of study, because there are 1,001 things you could have studied as a doctor, like when you decided to specialize. Why hematology? Why blood disorders?
What a great
Pray
question. And
tell.
thank you for asking me, Dr. Mecca. So I will tell you that I was on my way to becoming an oncologist. That's a cancer doctor because my
Mm-hmm.
father died of liver cancer. And so I felt like, I needed
Mm.
to like take up the crusade and fight cancer.
Yes.
So I was on that
Mm.
journey. And then
Mm.
fortunately in medical school there's so many different experiences and you meet so many mentors. So one thing that kind of took me off the path a little bit, I didn't know it took me off the path initially, was that I met a mentor who was actually a sickle cell doctor. So she was a
Interesting.
hematologist and we
Mm.
met every so often and we talked, but I was clearly still on
Mm.
the path to oncology. But because
Mhm.
of how I shifted a little, I said, okay, I'm going to become a malignant hematologist. But you know
Mm.
what? I had some experiences while caring for patients with malignancy that made me feel like I can't do this. I cannot be
Mm.
a doc of patients with
Mm.
cancer. And so
Mhm.
really then she came into the fore and I was like, I really love what she does. I love the
Mhm.
joy with which she practices. And I just
Mm.
associated that with hematology. And so, yeah, that's how I became a hematologist, a blood diseases doctor. So I take care of
Uh-huh.
patients with anemia, blood clotting, bleeding,
Mm.
all sorts of problems with their red cells, their platelets. And mostly, I'm a doc who specializes in bleeding and clotting disorders.
Interesting. That is a fascinating story. I'm always so fascinated, at the stories that we have, the journeys that brought us to do what we're doing right now, because I had said this before in the past. I wanted to be an ophthalmologist, and somehow during clinical training, I just fell in love with pediatrics. It's just wonderful when you kind of find an area that you just sort of, have a passion for. And we can definitely tell you have a passion for what you do because you light up when you talk about it. So, and I'm glad because we have lots of moms and dads who have questions when it comes to blood clotting disorders. There's usually sometimes some story. I would tell you, actually, just this past week, slightly different, but sort of, along the same vein. A mom with a baby who's literally like 2 weeks old had come for a regular visit, but was concerned about a little like bump she felt in the back there, which turned out to be a lymph node. She felt it was a lymph node, but she was worried if this baby was going to have like leukemia or something because someone in the family had, passed on from leukemia. And she was worried about this real small, solitary lymph node. But that is just the nature of things, right? When you have some family who's gone through something, you just worry about everybody else and if they'll be okay. So what do you say to a family who has had someone in the family, you know they've had some significant blood clotting issue? Everyone just knows they have a blood clotting problem and they worry about all the other kids, and how do they approach that? Where do we go from there?
That is such a great question, Dr. McCann. Thank you for asking me. I will tell you that a big part of my job, as I believe yours is too, is reassuring people, is
Yes.
really helping them calm down and not be so anxious and
Mm,
worried. And so
mm,
the first piece I would say is calm down. Don't be anxious, don't be worried, and just don't let anxiety overwhelm you. And I know that's easier said than done, but it's
yeah.
so important. But it's really important if there have been family members who've had blood clotting problems or bleeding problems. I think the first thing is just to talk with your doctor. And I'm so glad your
Mm,
patients, Dr. Mecca, have you,
yeah.
because you're the kind of doctor that I know puts them at ease and helps them really think through, okay, to what extent is this a problem?
Yeah.
Sometimes it's a remote family member, like somebody who
Mm,
married into the family, and it may
mm,
not necessarily affect the patient. But if it's clearly um, a problem that affects immediate family members, like an
mhm,
uncle or an aunt or a sibling,
yeah.
definitely worth talking to your doctor about to decide if any testing may be needed to help figure out what to do next.
Okay. So I'm supposing then, I do know some of the answer to that, that in some of these cases, the patients may not necessarily have any symptoms at all, and still have some predisposition to a blood clotting, blood bleed, or bleeding condition. Or do they always have to have some symptom, some presenting symptom?
That's a really great point. That's a really great question. And that's a question that we tend to answer a lot because we have people who are totally asymptomatic coming in with a list of ailments of family members and saying, Doc, what should I do? Should I be tested? Should
Mm,
I take precautions? And I think the point that you made is very, very, very helpful. Do you have symptoms? And that's really important. So let's talk about bleeding disorders. Many
mhm,
times, especially for children who perhaps for boys who may get circumcised or
mhm,
girls who may get their ears pierced, or even within the first few months of life, are there frequent nosebleeds, bruises, things that
mhm.
might make you worry that there might be something present? So I think the
Yeah.
question is, are there any symptoms?
Mhm.
Especially bleeding disorders, if they're inherited, tend to show up pretty early. For young women, when they enter into menarche, that's when some of these bleeding disorders show up. And so, are there symptoms? And that's, I think, the first most important question. For
Mhm.
blood clotting disorders, those tend to actually show up a little bit later in life, or if they're
Mm,
provoked in a different, like by different circumstances, for example,
okay.
surgery or
Mhm.
or major travel. So it
Mm,
is important to think about it only when people are symptomatic. Going after these things before they become symptomatic can present
mhm.
a conundrum because it's like, what do
Mm,
you do if you
we
find
do.
something but you've never had symptoms? I
Yeah.
think it's important to have those conversations before you go looking.
Interesting. Interesting. Now, before I can go any further, you said something that was sort of interesting. You said travel can provoke some blood clotting problems. Say a little bit more about that.
Sure. So when we think about predispositions to blood clots, there are some very major ones. For example, major surgery or
Mhm.
acute illness where you're bedridden and immobilized for a long time.
Yeah.
Some of the softer, but also potential causes of things that predispose people to blood clots are travel, especially if
Mm,
it's an extended period of travel. We usually talk
okay.
about flights that are 6 hours or more, where
Mhm.
usually people are not able to get up and move around or stay hydrated. So
Mm,
usually we're looking at flights that are 6 hours or greater, or
okay.
extended periods of travel where people are not getting up and moving around.
Okay. All right. All right. Get that. Get that. So I guess the pearl there is if you are going to be on a long haul flight, 6 hours or longer, you should be getting up ever so often to just sort of walk down the aisle, exercise, move, get things moving, and not be too sedentary, right?
Absolutely. We tell people for every 2 hours of travel, you should have at least 5 minutes of moving around.
Ah, very good. Every 2 hours of travel, I'll remember that next time I'm maybe going down to Nigeria or something. That's usually a long haul flight if it's a direct flight. All right. Well, I'm glad, that you have said that a lot of times that you really are trying to reassure parents because
Mm.
oftentimes there's usually nothing wrong or nothing serious to worry about right now. Or like you said, you even have to kind of decide how much testing you want to do if they're asymptomatic, if they're not having any problems right now. Some other area, and this, will be, I'm supposing, along the lines of conditions that you treat is, or how they present, is kids who bruise easily, and this can even be adults who bruise easily. I've found out in my practice over the years that a good number of times when they've said, I bruise easily, nothing's wrong. But there's been some, you can explain some of the bruising, some of the bruising when you actually look at it, and, and even when we've done testing, they've been okay. Like, when should someone be worried that they're bruising excessively? Since sometimes that can seem subjective.
That's a really great question, and thank you for asking.
Mhm.
As I was thinking about it, I was like, bruising can be, as you say, it can be nothing or it can be something serious.
Mhm.
So I think what's important is to figure out, number one, how has the bruising changed? Is this bruising
Okay.
new? And that's really important. Sometimes people will say, I've bruised ever since I was a little girl, and that's
Mhm.
interesting. It's helpful, but especially when people say, I've never bruised before, and now
Mhm.
bruising is a brand new problem for me, that might be
Mm.
something that might cause us to pay more attention,
Yeah.
because it's like, what's
Mhm.
changed? And
Yeah.
then much of the time, especially for people who just develop bruising, it's like, but what is in your diet? What's changed that
Mhm.
is causing you to bruise more? I'll tell you a funny story. We had a patient who started eating fish. She was eating fish
Mhm.
3 times a day. She was eating fish multiple times a day. And one of the great things about fish, it's got a lot of omega-3 fatty acids, but
Mm.
some of that fish oil can actually induce a little bit of platelet impairment, because fish
Interesting.
oil tends to do that. And
Mm.
so I think asking people
Mm.
about how have their habits changed? What new herbal teas might you be drinking? Are there any
Mm.
supplements? Those kinds of things.
Mm.
Medications, especially, because bruising makes me think about, are the platelets working like they're supposed to be? Are they low in number, or are they
Mm.
working like they're supposed to be? And so
Yeah.
sometimes a simple blood test to see, are the platelets the right amount?
Mhm.
And I don't necessarily go much beyond that unless
Mhm.
there's concerns that there's other bleeding.
Okay. Okay. That's very helpful. Which sort of leads me to ask then, are there things we can do to prevent blood clotting issues, especially with our diets and our lifestyle, the way we live our life, day to day? Are there things we can do to prevent blood clotting disorders or bleeding issues?
Really, really great question. So let's start with blood clotting. So, many times we're not always in control of how things work out. But to
Mhm.
the extent that we can be in control, I think avoiding a sedentary lifestyle is important, and avoiding the extremes of weight gain. So as people get older, their tendency to form a blood clot does go up, and it goes up very, very in a small manner, but then it can be additive to other things if it's a very sedentary lifestyle. And by sedentary, I really mean people who are like sitting in front of the TV 8 hours at a time. And
Yeah.
I know none of your patients do that, but
Absolutely
some of
not. Nobody's gaming that long.
but those are the kinds of things that can predispose you, especially with the extremes of weight, if you're gaining a lot of weight and sedentary.
Yeah.
But most of the things are outside of people's control. So major surgery, that's why with any major
Mhm.
surgery, we want to get people up and moving around as soon as they can, so that they're
Yeah.
avoiding the sedentary lifestyle. Now, if
Mhm.
there's a family history of blood clotting, that's important, because we're not always able to avoid the blood clots related to that. But there are medications that we can give, especially when people have major surgery, that can
Mhm.
help keep the blood a little bit thin and be
Yeah.
preventative as well. So that's for blood
Okay.
clotting. For
Mhm.
bleeding, I think it's mostly if you don't have an inherited bleeding disorder, which in
Mhm.
general people will discover when you're young.
Younger.
Then it's really, what are you adding to your diet? What new
Mhm.
medication may be impacting you? And so that'll be
Mhm.
something that's important, to make sure that if you're starting a new supplement, you're starting a new medication, you're checking in
Mhm.
with your doc to make sure
Yeah.
it's okay and it's not going to cause any significant problems.
Well, that's helpful. I know, especially in this day and age where we're all trying to build a healthier, generally speaking, people are thinking also of more natural ways of doing things. So we're looking more at supplements and looking more at herbal stuff, just to remember that sometimes some of those can impact our health negatively as well. So we have to be careful about that, like you said. And well, that's really helpful to know. So, Tell us a bit more about your other area of interest, which is, helping academic physicians develop a research program. And that sounds really fascinating. Tell us more about that. Because you never know, someone may be interested in hearing more from you.
Absolutely, Dr. Mecca, and I'm so glad that you asked me. So many of the questions you ask, we don't have complete answers to. Like when
Mm,
you ask, what causes people to form blood clots? We don't always know. And these are the areas that are just ripe for research. Who's going to
mm,
figure it out? I think clinicians are the best group of people to really try to answer these questions because they are at the forefront of all of these problems and they're in touch with
yeah.
their patients. But the
Mm,
problem for us clinicians is that we don't get research training. It's not part
mm,
of our
that
training.
is
And
true.
so we want to change our patients' lives, but we don't have the training to do that. So I
Mm,
am a coach. I help clinicians who want to build research programs, whether or not they have a mentor, and that allows them to thrive in their careers and they're able to really make a difference in their patients' lives.
interesting. That is really interesting. How did you fall into this area of interest?
It started for me 10 years ago when I was a new faculty member, and I really wanted to do research because I felt like that was how I was going to change the world. And people told me everywhere, you're not qualified. You've never done this before. You don't have any
Mm,
funding. You've never published manuscripts. And I just came up against so much opposition, which makes sense because I didn't
mm,
have the training. But I was
mm,
hoping that people would create space for me. And they said, well, if you have a mentor, and finding a mentor was difficult.
mm,
But over time, what I recognize is that it really takes transformation to go from
mm,
a clinician who's never had research training to being a clinician researcher. And so I help people make that transformation because it really is a big transformation from
mm.
thinking just as a clinician to really thinking as a clinician researcher.
That is just fascinating. And you're right, even sometimes for me, with just the thought of research, just, oh my God, research, right? You feel like it's this humongous effort, that's going to be required to really make a difference or do something significant. And from what I'm hearing, like, you really just need someone to take you through the steps and sort of show you the ropes and show you how to, like you said, really transform from you're thinking as just a pure clinician to a clinician researcher. Is that what am I hearing you right?
Absolutely, Dr. Mecca. It's a mindset shift from being a clinician who does research on the side to being a researcher who is using their clinical platform to really amplify their research and make a difference.
That is wonderful. Well, I am sure that the right person who's listening to this will want to get a hold of you. How do they get a hold of you, or how do just even moms and dads who are listening and just want to sort of maybe see if you have more to say about blood clotting problems or bleeding disorders? How can they get a hold of you?
Absolutely. And I would say, even for patients who are listening, you should encourage your doc. Hey, doc, you have so many
Mhm.
important questions to answer. You should think about talking to Dr. Onwuemene and
Yes,
seeing if she can help you make the transition to research. But yes, I am
absolutely.
available on all the socials. I am on LinkedIn and on Facebook as Toyosi and Onwuemene. I'm on Instagram as Coag Coach. I also have a website, coagcoach.com. And you can find me if you Google me, you can find me. I've published a few papers. So I'm available online and I'd be happy to hear from people who are interested in making that transition from clinician to clinician researcher.
Wonderful. Well, I knew this was going to be fascinating because parents always have concerns and probably oftentimes have concerns about blood clotting issues, especially when there's a family history. So thank you for clarifying some of those questions we have in our minds as parents. It really has been great to talk to you, and thank you for sharing your passion with us, not just for the clinical work you do, but also the clinical research work you do as a coach. That was so nice to hear. And again, thank you for coming on.
I appreciate the space you've made for me, Dr. Mecca. Thank you for having me.
Oh, that pleasure was all mine. Well, thank you for stopping by. If you stop by later on, go ahead and type hashtag replay. I would love to be able to stop by and say hello. If you're looking for a pediatrician or a family practitioner in the Washington County area in Maryland, give us a call, 301-791-7060. Would love to be able to take care of you. And thanks again for stopping by. And I'll be here again next week. All right, take care. Bye.